Facelift surgery, also known as rhytidectomy, is a cosmetic procedure aimed at rejuvenating the face by tightening sagging skin and muscles, smoothing wrinkles, and restoring a more youthful appearance. Here is a general overview of the facelift surgery process. 1. Consultation. The process begins with a consultation with a board-certified plastic surgeon. During this consultation, the surgeon will assess your facial structure, discuss your goals and expectations, and determine if you are a suitable candidate for the procedure. 2. Anesthesia. On the day of the surgery, anesthesia will be administered to ensure your comfort during the procedure. This can include local anesthesia with sedation or general anesthesia, depending on the extent of the surgery. 3. Incisions. The surgeon will make discreet incisions, usually around the ears and sometimes along the hairline, to access the underlying tissues. The incisions are strategically placed to minimize visible scarring. 4. Tissue repositioning. The surgeon will lift and reposition the underlying muscles and tissues to restore a more youthful contour to the face. Excess skin may also be removed. 5. Liposuction. If necessary, in some cases, liposuction may be performed to remove excess fat deposits in the neck and jawline areas for improved definition. 6. Skin redraping. The surgeon will redrape the skin over the newly repositioned tissues. Excess skin is trimmed, and the remaining skin is smoothed to reduce the appearance of wrinkles and sagging. 7. Incision closure. The incisions are meticulously closed with sutures or staples. Some surgeons use techniques that minimize tension on the incisions to promote faster healing. 8. Recovery and follow-up. After the procedure, you will be monitored closely as you recover from anesthesia. You will be provided with post-operative instructions on how to care for the incisions and manage any discomfort. 9. Results. Over the next few weeks and months, swelling and bruising will gradually subside, revealing smoother, firmer facial contours. The final results may take several months to fully manifest. It's important to note that the specifics of a facelift surgery can vary depending on the individual's unique anatomy, the extent of the procedure, and the surgeon's techniques. If you are considering a facelift, it's crucial to consult with a qualified and experienced plastic surgeon to discuss your options and expectations in detail. Contact us now to know more information.